Welcome to Jason Live. My name is Haley Nelson, and we are back with our STEM career series where we learn about careers in science, technology, engineering, and math from role models in those fields. And today's role model is Dr. Icilma Fergus Rowe. Dr. Fergus is a cardiologist. She helps patients who have heart or cardiac problems, and she's doing really exciting work with her research on heart disease in women. And we are going to learn all about that and more when we talk to Dr. Fergus in just a few moments. But first, I want to remind you that today's event is live and interactive. So below this video, you'll find a box where you can ask questions and participate in our polls. So we're going to try to get as many of you involved as possible. So listen for your names and your question. So now it's time to say hello to Dr. Fergus. Welcome. Thank you for joining us today.
Good afternoon. Hello. It's my pleasure to be on this wonderful program, and I hope that we will all learn together today.
We are excited to have you. And I think we should just jump in and start asking questions right away. Can you tell us a little bit of the basics? What does a cardiologist do?
Okay, that's an excellent question. Well, a cardiologist is a specialist, a doctor who takes care of hearts and help people to not have conditions of their heart, such as heart attacks, heart failure, heart valve issues. But I also do a lot of teaching. I teach medical students. I teach other young people how to become doctors. But I also teach my patients, and I teach the community. So you can say that a cardiologist is a doctor, but also a doctor who does a lot of teaching and learning also throughout our entire career.
Looks like we have a question that has come in. This is a question from Brianna. As a cardiologist, what do you teach your patients and the community?
Thank you, Brianna. That's an excellent question. Well, I think that if patients are to live longer and be more healthy, they should get involved in their own health. And so when I go into the community, I tell them about different conditions and how they can help themselves by living healthy lives. So I might teach them a little bit about nutrition, about exercise, but also some chronic types of conditions such as high blood pressure or diabetes, and how to stay fit and healthy. So those are some of the things that I teach people in the community.
That's so important. We have another question right away from Amanda. She asked, what is an EKG and how does it work?
Amanda, that's an excellent question. An EKG tells you about the electrical activity of the heart. I always tell my patients that the heart is sort of like a factory. It works with plumbing, it works with electricity. So the electric activity of the heart tells us how well is the heart functioning. What we do is we put some electrodes onto the patient's chest, and then we look at what happens to the heart's electrical activity, and we can see what is reflected on a piece of paper. What you saw just now on the screen was an echocardiogram, which is more of a sonogram of the heart.
Well, that's very interesting. Now, if you're doing things like this, how do you conduct your daily routine?
Okay, that's a great question. So each day for me may be slightly different. If it's a patient day, I generally start the morning making patient calls, looking at my schedule to see which patients will be coming in so that I'm prepared to answer their questions and be prepared to provide the best possible care. And so I may have, a number of patients who I'm planning to see. They'll come in, the nurses will check their vitals, that is their blood pressure, their heart rate, their oxygen, their weight, and then provide sort of background information for me for those patients that I don't know. And then I spend time with the patients, examining them and talking with them, and then discussing their health together.
You have full days. Well, we have another question coming in. This is from Nicholas. He says, isn't the heart just a pump? If so, then why can't you just replace the heart with a cheap, always working pump?
That is a really great question, Nicholas. And there are some patients who, unfortunately, their hearts don't work and they do need a pump. But you can't just replace the heart with any pump, because the heart is a live organ and it needs to work with the rest of the organs in your body. The brain needs to be able to communicate with the heart to tell the heart to pump and to adequately provide enough blood and thus enough oxygen for the body. So therefore, you can't just go out and buy a pump from any store. Unfortunately, there's some people with a very, very weak heart and their heart may not work as well. So some of those patients end up needing a heart transplant. But for those who don't have a heart transplant, there's a type of pump that's called an LVAD, or a left ventricular assist device. What it does, it actually helps your heart to pump so it can work more adequately to provide the necessary oxygen for the body.
Sounds really complex and lots of different ways to help your heart pump. We have another question that's come in from Ryan. If an older man or woman receives a heart transplant from a younger individual, will it increase their lifespan?
That's a very interesting question. Well, I think that the younger heart, or the younger the heart, the more likely it will be able to function, be strong, and provide what's needed. But no one lives forever. So unfortunately, if you're an older individual at some point, the heart, even though it's a very young heart, will eventually not work as well. But in general, if you're going to have a heart transplant, it would be better to have it from a younger person.
Hopefully we can just take care of the one we have first if we can.
Absolutely, absolutely.
We have another question from Emily. She asks, what damage can be caused by drugs to the heart?
Emily, that's a great, great question. Now, there are different types of drugs. So there are medical drugs, and then there are drugs that are from the street, and there are drugs that doctors prescribe. So each one of those, when taken, the medically prescribed drugs, when taken appropriately, are great. But even some drugs that are given to help, such as cancer drugs, certain cancer drugs can cause the heart to get weak. And so we monitor patients who receive certain types of drugs called anthracyclines or other types of chemotherapy drugs, and certain antibiotics may have an effect on the heart. In terms of street drugs, what happens, there are two things. Certain drugs can really speed up your heart and make your heart become very, very fast. The word is called tachycardia. And when the heart is pumping so fast, then it doesn't work properly. And sometimes taking drugs off the street can cause an infection called endocarditis, which is an infection of the heart valve. So yeah, sometimes drugs can affect your heart.
Well, let's only take the ones that are going to help our heart. Let's do that.
Exactly.
And this is from Kahaya from Miss Klim's class. She asked, what heart diseases do you specialize in?
Oh, that's an excellent question. Thank you for that. I am what's called a non-invasive cardiologist. Non-invasive means that I don't cut people open, I don't put wires into people, but I take care, I look at patients, get their diagnoses, I provide medications, medical care, I look at non-invasive testing, such as we talked about before, EKGs and echoes and stress testing. And then there are other tests such as Holter monitors, which is a little box that someone can wear for 24 hours or longer to look at their heart rhythm. So a non-invasive cardiologist doesn't do any type of testing that hurts anyone, but we provide care and we provide a lot of preventative interventions, teaching, etc. So to have people live longer and healthier lives taking care of their hearts.
That sounds good to me. Let's look at our question from Oma. Are men and women more prone to heart disease, or are men or women more prone to heart disease?
That is a very, very good question. Thank you. That actually comes from Oma. My son RJ goes to Oma in New Jersey. So heart disease is the leading cause of death for everyone here in the United States, but also in the entire world. And women in particular tend to suffer more adversely or have worse outcomes from heart disease compared with men. And as women get older, they're more likely to have heart disease conditions and have worse outcomes than men. But heart disease can occur in both men and women, and so we all need to take care of our hearts.
I'm surprised. I actually thought men had worse cardiac problems. We have another question already. This is from Mimi. If the heart needs to be able to communicate with the brain to function, then how does it communicate?
So that's a great question. And then I'll come back to the other question you had, Haley. I would like to talk about that a little bit more about heart disease with men and women. But first, Haley, your heart is an organ that is sort of, it works on its own. So you don't have to tell your lungs to breathe and you don't have to tell your heart to pump. And there's sort of a complex interaction between the heart and the brain where the signal comes from the brain that tells the heart to automatically pump. And so we don't have to do anything but exist in our heart. If it's healthy, we'll receive the appropriate signals from the brain and will continue to pump, hopefully 60 to 100 beats per minute, which is the normal rate of beating.
Well, we've got some more questions about that, about the differences you were talking about. Why is it
Sure.
important to research the differences between men and women's hearts?
That's a very, very good question. And every February, we spend a lot of time talking about heart disease in women. That's one of my favorite subjects and one of the favorite things to deal with, because the misconception is that women do not suffer from heart disease, but women can actually suffer from heart disease at all ages, even younger ages. As I said before, as women get older, then they're more likely to have more significant heart disease compared with men, but men and women both have heart disease. Our anatomy as a woman or a female, our anatomy is a little bit different than men. We may have smaller blood vessels, and we may have atherosclerosis, which is hardening of the arteries, or certain things that are a little bit different in men compared with women. The other thing is that women, their symptoms when they're having a heart attack may be a little bit different. When men are having a heart attack, it's described as an elephant sitting on the chest, a very heavy pain sort of on the chest that may go down the left arm, whereas a woman may not feel the same type of pain. They may just be tired, they may have a racing heart, they may feel the pain somewhere else on the right side of their chest or in their jaw. So it's important to recognize these differences so that when a woman comes in to the emergency room with a heart attack, that it's not missed for something else and mistaken for something else.
I can see how that would be easy to miss. We have another
Yes.
question. This is from Lucia. Did you ever think a heart was gross?
Well, Lucia, I think you're asking me a question that I could relate to when I was in my training or when I was beginning to think about becoming a doctor. So everyone has to do a type of course that's called gross anatomy. It's literally called gross anatomy, but it doesn't mean that it's gross in the way that you mean. And doing that particular course, we actually get to look at all of the hearts and hold them in our hands, etc. So yes, I initially had to get over being squeamish about blood and being squeamish about organs, but once I got through the gross anatomy course, I was fine with dealing with hearts and even holding them.
Well, let's see what else we have for you. That was a fun one. How many patients do you usually have a day? Are most of them serious cases?
Okay, that's a really great question. Well, I may have anywhere from 5 to about 20 cases or patients per day. So if a patient has a very complicated issue and you need to spend a lot of time with them, then you'll have less cases. But I can see anywhere from a very mild case where someone's having a racing heart and it may be just that they're anxious, to a very significant case where the person may end up needing to have open heart surgery. So it really varies and it really depends on, who's being referred on a particular day.
You have to be ready for anything. Here's our next question. This is Zini from Miss Clem's class. Have you ever had heart problems before? And if not, have you ever failed to help the heart?
Okay, that's okay. Well, I myself, thankfully, I have not had any heart problems, but as a female, I have to be aware that I may have heart problems. And so I have to get involved with watching the things that I eat, watching my salt and the fats and the amount of food that I eat and staying healthy and exercising so that my heart can stay healthy for a very, very long time. And the second question was, what was the second question, Haley?
It was, have you ever had failed to help anybody who had a heart problem?
So I can remember when I was a fourth year medical student. So this is one of the probably what really made me wanted to go more into taking care of the heart. So I had a patient who was waiting to get a heart transplant. He was very, very sick, and he was waiting to have it was near Christmas, and he was waiting to have a heart transplant, and he had all of the plans that he wanted to spend some time with his grandchildren. Unfortunately, he did not receive a heart on time, and he passed away. And I felt very, very sad because all of the plans that he told me that he wanted to do with his grandchildren, he wasn't able to. But sometimes we have very, very sick cases, and unfortunately, sometimes some people, they're just very sick, and we have to give them medicines, but we can't really do much to help them.
Yeah, you must just be able to do your best and do what you can for a person at that point. That's very sad.
Yeah.
We have another question. This is from Nick. Is too much salt bad for your heart disease if heart disease runs in your family?
Yes, that's a very good question, Nick. So salt is good. It makes your food taste really well, but when you eat too much salt, then it could be bad for you. So in general, we try to keep, and I'm going to give you some numbers here, 2 grams or 2,000 milligrams is about the number that you want to stay at, not go above. And here in the United States, we tend to eat a lot of salt, up to 3,500 milligrams or 3.5 grams per day sometimes. However, what happens is when you eat or ingest a lot of salt, the body retains or keeps in water, and salt and water together can make your blood pressure be higher. And if you retain water, you can get swollen. So too much salt is bad. And if you have a family history of hypertension or high blood pressure, reducing your salt would be one way that you can help yourself from not getting blood pressure in for your own self.
We have another question ready for you from Alma. How is a patient kept alive during a heart transplant?
Okay, that's a very, very good question. Well, first, if you don't mind, let me tell you what happens when they get the heart transplant or when they're getting open heart surgery. What happens, there are certain machines that actually pumps the blood of the body while the surgery is happening. And what happens is the heart gets inserted into the chest and everything gets connected. And then the heart is amazing. Once the body comes off the bypass machine, which is the machine, again, as I said, that pumps all the blood while the heart's not beating, then once everything's connected, it starts to beat on its own. It gets a signal from the brain, as we said before, and then the heart, beats and pumps, and the person stays alive and well. One of the things, though, is that when someone has a heart transplant, because it's from another individual, there can be what's called rejection, where the body may reject the heart. And so that person has to continue to take certain medications to reduce the likelihood of rejecting the heart and also keeping that new heart strong within the body. So I hope that answers your question.
And we have another question right up. I think you answered that really well. From Megan, do you think the heart is a complicated organ?
Yes, indeed. The heart's a very, very complicated organ, and it never ceases to amaze me. But an easy way to sort of understand what the heart does, and one of the students before described it very well. The heart works essentially like a pump, but another way to think of it is I think of the heart as a 4-room factory. So there are 4 chambers of 4 rooms. There are 4 doors or 4 valves, and there's plumbing, right? So the blood has to get through. And these are the arteries and veins. And then you have the electricity that I talked about before. So think of it as a 4-room factory that has 4 doors, and it has plumbing and it has electricity. But it's very complicated, but it does a very simple thing, which is just pump so that the blood can go circulate around your body and carry oxygen to the necessary organs.
It is complicated. It's amazing. It works so well all the time. And we have another question from Alma. Is it possible to get a blood clot in your heart? Can you survive from that?
Oh, that's a wonderful question. Very interesting. Yes, you can get a blood clot within the heart, and yes, you can survive from a blood clot in the heart. There are certain medications that are called blood thinners A very simple blood thinner that you may take on a given day is an aspirin. Maybe some of you have taken an aspirin before, but an aspirin is a blood thinner, and it prevents the platelets, which are little tiny cell-like products within the blood, from clotting. And there are different conditions that may make a clot form in the heart. If the heart's very big and it's not working or pumping very well, that's one way that a clot can form within a heart.
It seems like there are a lot of things that you can do to help for that. We have another question right here. This is from Kaya from Miss Clem's class. If you were to meet someone who has suffered many heart attacks, would you treat them differently or the same as everyone else?
Okay, thank you, Kaya, for that question. There are two ways to answer that question. I mean, I treat all of my patients the same way. I'm very nice and professional for them, but with someone who's very, very sick, you have to spend more time with them because sometimes they're on many, many different medications, and there's certain restrictions that they have to engage in. So they have to watch, what they eat and how they exercise. And so I would spend a little bit more time with them, just making sure they understand what they need to do, how to take their medications, if they have any questions about side effects, and what types of physical activities should they or should they not do. So while I treat all of my patients the same, I may spend more time with someone who has a more complicated condition.
That makes a lot of sense. We have another question from Ava. How has your job evolved since it first came into science? Let's see, how's your job evolved since you've had it?
Okay, that's a great question. I had to do a lot of training first. I trained for 15 years through college and medical school and residency, and then training as a cardiologist. And I started out initially spending most of my time within the hospital and, taking care of patients, but also doing some of those non-invasive tests that I talked about before, such as stress testing, echoes, EKGs, Holters. And now I spend a lot more time teaching and lecturing and traveling. And one of the fun things that I do now is that I provide care for patients even far away, not in the United States. And I recently traveled to the island of Montserrat, where we spent 1 week taking care of sick patients there. And that's very fun, spending time away from the United States, but providing care where people have some of the same conditions that we have here in the United States, but they may not have as many resources, or they may not have as much help. So that was really great, and I like the way that my job has evolved to allow me to go and do some of that, to volunteer and take care of these patients.
Why do you have such a heart for Montserrat?
Yes. Oh, why do I have such a heart for Montserrat? Well, I was born in Montserrat, and my family's from Montserrat, and I went to school there as a young lady. But about 4 or 5 years ago, after having not been there for years and years and years, I was invited to come and provide special care for individuals on the island of Montserrat, which had become ravaged by a volcano that devastated the entire system. And this picture is showing you a town that was wiped out, or the capital actually, that was destroyed and wiped out by the volcano. And all of the specialists left the island. So I was invited to come with my team and provide cardiac and medical care for individuals who still live on the island of Montserrat. And so it's very special. Yes, and this picture is shown from my recent trip to Montserrat, where, again, this is part of teaching outreach to the community, but sometimes you do teaching by showing a physical act. And here is what we call a call to action, where we had individuals learn about exercising and being healthy. And that was a hike where we climbed to over 1,400 feet into the mountains, but just a call to action so that people could start to become more healthy by exercising and walking.
It looks like such a beautiful place. Can you tell us a little bit about the island, what it's like there?
Yes, I can. The island is a British island. It's in the Eastern Caribbean with some of the smaller islands. The temperature generally goes anywhere from, at night, the lowest it probably gets to is about 50 or 60, and and then it goes up to anywhere on a nice day, 80 to 90 degrees. But because it's surrounded by water, it's never as humid as here in the United States. Everyone's very friendly and very nice. The island's very, very green. And they spend a lot of time actually doing agriculture, that's growing your own vegetables and, basically doing some of the same things that we do here. But because of that volcano, many of the resources, so things that you would normally do here in the United States that you take for granted, such as going to the movies or bowling, etc. Some of those are no longer present on the island.
It looks gorgeous, but very different from where you live in New York City.
Absolutely.
Well, we have another question ready to go from Megan. Do you have to be brave to undertake your job?
Yes, Megan, that's a great question. Yes, you have to be brave because sometimes you see people who are very ill, very sick, and they're very young. And as I mentioned before, sometimes you can't help every single person. So one has to be very brave because you have to be able to talk to the person and talk to their family and be optimistic and, just be able to, stay strong without, crying or breaking down because you may feel sorry for the person. So, yeah, I think being brave is definitely one of the things that I have to do.
Yeah, it takes a lot of strength, it would seem. Well, let's shift and talk a little bit about your past career. We have a question ready to go from Lucia. What inspired you to become a cardiologist?
Lucia, thank you. That's a great question. What inspired me? I guess when I was a college student and I was doing work study, one of the things that I had to do, I worked at a medical center and I saw where they were doing research, and the research was on sick dogs who had bad hearts. And some of these dogs were very sick, and it was very sad for me to see these dogs with very poor hearts. And at that time, I made it my quest that I actually want to do something where it can help hearts to become strong. I didn't want to do it for animals, but for people, because being a healthcare provider for an animal, that person's called a veterinarian. I wanted to take care of hearts in people, and so seeing those dogs back then when I was in college, that really inspired me to become a cardiologist.
You just knew.
Yes.
We have another
Yes.
question from Avi. How much training did you have to go through? You talked about that a little bit, but let's hear more about that.
Yeah, so it takes a lot of training, but it goes very quickly. So you go through high school, college, 4 years of college. For me, I actually spent some time after college working at a medical center because I wanted to decide on whether I wanted to be more of a researcher or a clinician. But then after college, you would then have 4 years of medical school. Medical school is where you spend time learning all of the sciences about the body. And I talked about gross anatomy. That's anatomy where you really actually look at a body from the outside in. You start from the outside and you dissect the body and you see everything about the body and learn about it. And so you go through 4 years of all the sciences, and then you start to meet patients and you begin to learn what it is to take care of someone and how to ask questions and how to handle that. After medical school, so now that's 4 years of college, 4 years of medical school, then you do what's called your residency training, where you begin as an intern. That's your first year of residency in a medical center. And your residency can either be anywhere from 3 years to 6 years. It depends on whether you're going into general medicine or surgery. In my case, I did 3 years of general medical residency, and then I was fortunate enough to become a chief resident, which is a resident who stays on to be in charge of all the other residents who are training. So that was 4 years. And then from there, I wanted to become a cardiologist, and you have to do some additional training to be a cardiologist. For a non-invasive cardiologist, it's 3 to 4 years. So altogether, I did 15 years of training after. Yeah.
By the time you get through 15 years, you feel like you can do what you're supposed to, I hope.
Yeah.
Well, we have a comment from Larry. Why did you choose to study hearts rather than another organ?
Okay. Well, I think the dogs inspired me. I wanted to, help people with healthy hearts. But when you go through your medical school and also your residency training, you get to, see all of the different disciplines. And so you rotate through all of the different disciplines, OBGYN, surgery, and then during medical training, you see the lungs and the liver and all these other things. But I think that the heart is a truly complex and complicated organ, but it's a critical organ because you cannot live without your heart. And it was very interesting and intriguing to me, and that's one of the reasons I wanted to study hearts and to take care of hearts.
That's neat that you fell in love with it and it continued to be what you wanted to study. That's really neat. We have another question here. This is from Mrs. DeMaio's second grade Salem school. What other jobs have you had, like non-medical jobs?
Non-medical jobs. During high school, I was a counselor. I worked with kids. I remember the PAL, and I really enjoyed that. I also, during college, I babysat, and I really enjoyed babysitting. And in fact, while I was babysitting, I thought briefly about being a pediatrician, but I love babies too much to be a pediatrician because someone asked about being brave. I don't think I could be brave with a sick baby. But yeah, so I babysat, and then during college I did work study. That's where I saw those dogs. But during that time, I just worked as an admin assistant, and I also worked at a department store during Christmas break or whatever during college. So
Me
I did
too.
a couple of things. Yes.
We have another question here from Javier. When you were learning about hearts, what interested you the most?
Okay. What interested me the most about hearts? I think just I just couldn't understand how the hearts worked in terms of it was just such a miracle that these hearts are able to beat, that the blood knows where to go, and that the right amount of blood comes out when a heart's functioning normally. But I think just the complicated nature of the heart, but the simplistic manner in which it worked was very, very interesting to me. I enjoyed, just learning about the valves, so the openings of the heart, and I enjoyed understanding how the heart is a muscle, but that it actually has all of these complicated, intricate things that sort of, work. Make it work properly, and how compared to the rest of the body, relatively, it's small but so powerful. So all of these different things really drew my interest to the heart.
The more complicated it is, the more beautiful that it really works.
Well,
We have more questions for you.
Yeah.
Oh, pardon, I couldn't hear you.
No, I said the more interesting it becomes, I guess. Yeah.
Absolutely. We have a question from Lucia. If you couldn't study in the cardiology field, what field would you choose?
Do you mean within medicine or just outside of medicine?
Let's go with medicine.
Let's go with medicine. I think for me anyway, and I think for several other people who I've spoken to, what they felt that they wanted to do evolved or changed over time. When I sort of thought about doing OBGYN, which is obstetrics and gynecology, which is delivering babies and taking care of women, various health concerns. After delivering a couple of babies, because everyone goes through that training as well, I didn't think that I wanted to do that. So within the field of medicine, I guess it would have been OBGYN. I also like to do things with my hands, and I like to suture, so I thought about doing surgery. The reason I didn't do surgery is because the training is even tougher than training with medicine, and I wanted to spend time really having a family as well. So as I rotated through surgery, I liked it, but I didn't like it enough to choose that. I wanted to choose a medicine, which then led me to cardiology.
Well, let's take a break from asking Dr. Fergus questions. She has some questions for you. So let's see if you can answer her questions. And here are some polls here. And just to remind you, you can participate in the polls in the box below. What tool does Dr. Fergus always use when caring for patients? Is it A, stethoscope, B, EKGs, C, CT scan, D, stress tests, or E, all of the above? We did talk about a few of those things in the talk here. Could be A. We've seen a few of those. Let's check in here. Let's see what the polls are starting to say here. We have stethoscope, 33%, 67% all of the above. All right, Dr. Fergus, what's the real answer?
Okay. Well, I guess that was kind of a trick question, because the question says always, what do I always use?
Tricky.
So it doesn't say what do I sometimes use, because all of those things can be used sometimes. But when you're seeing a patient, you should always have a stethoscope. The stethoscope allows you to hear the heart as it beats. It allows you to hear the lungs as somebody's breathing, so you can hear the air as it goes through the lungs. Or is the person breathing properly? Do they have asthma? Do they have fluid in the lungs? You can also listen to the other vital organs, such as the stomach. You can hear the blood flowing through the blood vessels. So when I see patients, I always have a stethoscope. Sometimes I'll do an EKG, and sometimes they may need a stress test or a CAT scan, but always a stethoscope.
Well, now we know you're sneaky. All right, we'll go on to question number 2. What scary thing happened to Dr. Fergus on the island? A, she saw a snake. B, brakes gave out while driving. C, there was a hurricane. Or D, all of the above. Ooh, there are some interesting things here. If you're scared of snakes, that could be really scary. But brakes driving while, ooh, that's really dangerous. And a hurricane, on a tiny island. Ooh, let's see what people are saying here. We've got 25% saying there was I forgot what that one was. And then we got brakes, 43. Whoa, okay, that's jumping up here. Let's find out what the real answer is. What's our real answer?
Yes, the real answer is the brakes gave way on the island while driving down a hill.
Well, going down a hill, tell us about it.
Down a hill. First, let me say there are very few snakes on the island of Montserrat. So when we went on that tour, the one thing he told us not to worry about was looking for snakes, because there really aren't that many. And a hurricane didn't happen. Usually that happens a particular time of year, starting from the summer towards early fall. So neither of those happened. But I was driving a Jeep, and in the island of Montserrat, as I mentioned, it's a British island, so you drive on the other side of the street, and you also drive on the other side of the car. Notwithstanding, because I've driven those cars before, you have to use the brakes a lot because it's a very, very hilly island, and I don't think you can really appreciate it from some of the pictures that I showed. But the first day that after we arrived, then we were heading to the hospital to provide care, and I was riding with a couple of my teammates, and I first felt the brake coming down one of the really steep hills called Bulgari Hill, which is shaped like a snake and very steep. So after we made it down that hill, the brakes felt a little loose, and I said to my teammates, I think that we should take this car to get this car checked out. I don't like how the brakes feel. But then when we came to the next hill, the brakes just would not work. So that was a very scary moment. I think in that moment, I did have tachycardia. My heart rate probably increased quite a bit. And so what I did was just let it go into sort of neutral. And then the first flat place that we saw on the left, I stared onto that flat place, and the car eventually came to a stop. And then we got a car afterwards that worked very well. But during the moment that the brake wasn't working, I think everyone actually we didn't have a heart attack, but we had fast heart rates. And someone with a weak heart probably may have had something a little bit more significant. That being said, I would go back anytime, and I think in general they really check the brakes because, again, it's a very, very hilly island, and you end up using a lot of brakes all the time.
Well, thank goodness you knew what to do. We have one more poll question. You're giving us some doozies. Which career path would Dr. Fergus choose if she were not a cardiologist? A, astrophysicist, B, opera singer, C, anthropologist, or D, interior designer? I knew we had this question before. That's why I asked you what you would do in the medical field.
I
So,
see. Yeah.
all of these things would be really cool, fun things. Let's see what people are saying here. I know the answer because I read up on you. 67% say opera singer and 33 interior design. All right, what's the answer?
I love that. I love that. I love that they think that I would want to be an opera singer, but the answer is interior designer. And again, I think because I do a lot of things with my hands, and I love to, that's one of the things with cardiology, doing things with your hands. So with interior design, you get to create and put colors together and put designs together and all of that. So that's what I would have loved to do, and maybe one of these days I'll get to do it. If I retire from being a cardiologist.
Well, let's go ahead and talk about some more of what you do now in your current career. What do you want to do on the island of Montserrat in particular?
Right. So that's a great question. Each time I go, I get reminded of, how much there is to do and, how little time. I mean, we go there for 1 week out of an entire year. And then many of those patients I don't see until the following year. So what I would like to do is to have a more frequent, team of specialists go to the island. We're planning to go back in November. And then I would also like to provide some basic testing on the island. There's no stress test machine. There's no CT scan. We take a lot of those for granted. So for patients, we normally have to refer them to another island. And, if they're very sick, it's tough to travel. You can get to the island either by a tiny plane that holds 6 people or by a ferry. So imagine having a sick person, either trying to get them onto that tiny plane or the ferry to go to another island. So I would eventually like to have basic testing equipment available on the island, stress testing, CAT scans, and some other basic supplies. I would also want to ensure that as many people as possible are able to learn CPR and BLS, which is basic life support. You can see in this picture that we're teaching some of the nurses how to do basic life support by pressing on the chest of a mannequin there. Given the fact that it's so tough or so difficult to get off the island if something happens, we're hoping to train as many people as possible on the ground how to do basic life support and CPR. And this is one of the things that the American Heart Association is actually doing here in the United States, which is the program is called CPR Anywhere. And, even students can save lives by learning how to compress on a chest. And it's really fun. You do it to the tune of staying alive. You compress on the chest. Basically, that could be very helpful if someone passes out and loses consciousness because their heart stops. You can actually save someone's life. So on the island of Montserrat, if everyone knows how to do that, and if someone loses consciousness because of their heart, they can be helped at least temporarily until either they can get to another island, or we have equipment there to provide that care.
That really seems like it would be the most important for transportation challenges to go ahead and have something in place like that. We have more questions. This is from Avi. What's the hardest part in your job?
Okay, that's a good question. The hardest part, I think, is when I'm away from my family, because sometimes we work many, many hours during a week and, don't get to see my family as much. Or if I'm traveling away to an island or some place around the world and I can't take my family, I don't get to see them. So I think the toughest part is not having enough time to spend with my family sometimes, but not all the time.
Yeah, that sounds tough. I mean, it's a balance, I suppose. Here's another question from Megan. What's the most interesting part of your job?
Yes, the most interesting part for me is just meeting so many new people every day. My patients are fascinating. They're wonderful people. And part of what makes it so joyful is everyone's an individual, and even though some may have some of the same conditions or illnesses, but everyone's an individual and everyone's very different. So just meeting people and hearing about their lives and their family and how they came to be where they are, how they got sick, or just what do they think they can do together with myself as their doctor to get better. That's very, very interesting to me and for me. Yeah.
Well, it's interesting for us too to hear all about it. Well, we have another question from John. What's your most favorite part about your job? That's a little different, but your most favorite.
Favorite part of my job? Well,
Or maybe a favorite moment to switch it up a little bit.
Favorite moment. Favorite moment. Let's see. Many favorite moments, I guess. But I think that, okay, so one of my favorite or most interesting parts was I saw a young woman, and again, this was actually in the Isle of Montserrat, and this is to answer the question where we say there's not a lot of heart disease in women. This was a young woman who, again, sometimes doctors think the same, that maybe there's nothing wrong. And so this young woman, I was thinking there's really nothing wrong with her. She's maybe just short of breath. And this young woman turned out to have almost a liter of which is a soda bottle equivalent of fluid or some sort of liquid around the heart. Wow. And so that was very, very scary. And I wanted to really help this young woman. And so we, all of us sort of got involved, the team, and then we ended up medevacing her. That's getting the airplane, getting her onto the airplane, getting her off the island so that they could take care of her heart. And then going back and realizing that she survived and she's doing well. And, I was really happy that we were able to help. So that was a very interesting and a very memorable time for me that we were able to help her like that.
We're in the right place at the right time. We have another question from Mimi from Miss Clem's class. What is the most recent fact you found out about hearts?
The most recent fact. So, as a cardiologist, we have to study and learn all the time and, follow what's called clinical trials or research that's done on hearts. The most recent fact that I found out is that, I guess there's a new medication that just got discovered for heart failure. It was first studied in Europe, but it's going to be used now in the United States. And it's a simple compound that was tested over 10 or 12 years ago. And 10 or 12 years ago, that compound didn't work as well. But now that they've tested it in Europe on several thousand people, they're now finding that it works even better than some of the other medications that have already been used for heart failure. So that medication is one that's coming out soon, and we'll be using it along with some of the other medications we have for heart failure.
That's great. And simple compound sounds good. We have another question. This is from Amar. What would you do if someone had a heart size of a strawberry and on the right side of the body? Okay, so a very small heart on the wrong side of the body.
Well, the strawberry is very small, but I think the question could be, if you have a very, very small heart, hopefully you're a very, very small person. If everyone makes a fist right now, your fist should be the size of your heart. So that's the average size. So some hearts are a lot bigger and some are a lot smaller. If the heart's on the right side of the body, that's called dextrocardia, meaning dextro is right, cardia means heart. So dextrocardia means that you have a heart on the right side of your body. And most people have hearts on the left side of their body. So if you put your hand in the middle of your chest and then kind of slide it to the left, you should feel your heart beating. Okay, well, most people have a heart on that side, but some people have it on their right side. You can be completely functional and completely normal with a heart on the right side of the body. And sometimes we even pick that up later on in life, maybe doing an echocardiogram. But there's certain conditions where all of the organs get reversed. That's called situs inversus. And when that happens, it could be linked to some other disorder, and then sometimes that could be a problem. But just having a heart on the right side of the body may not be an issue. And having a small heart, if you're a small person, you can have a very small heart. I don't think the heart would be the size of a strawberry, though. For most people, the heart is about the size of their fist.
We have another question from Larry. How hard is it for your heart to recover from a heart attack?
That's a great question, Larry. Larry, it really depends on a couple of things. How long was the heart suffering from the heart attack before help came to the heart, before someone gave the heart the appropriate medications to revive the heart? It also depends on where in the heart attack is occurring. So if a heart attack occurs on the front of the heart, it's different than if a heart attack occurs on the side of the heart or on the bottom of the heart. In general, heart attacks that occur on the front of the heart, because the front of the heart is not protected, then the heart becomes weaker, and it usually takes them a longer time to recover. However, with all of the technology and treatments that we have these days, even a heart attack on the front of the heart, if the person is treated immediately. So there's certain medications that we give that are called clot busters, so lytics that break up the clot, or they get taken to a cardiac cath lab, which is a lab that can open up the blood vessel. And if that happens within a certain time frame, and we try to do from the time that someone gets into the hospital to the time the artery is open, we call that the door to balloon time. And we want to have that ideally about 1 hour. And if someone can get into a lab, get their arteries open within an hour, then their heart has a very, very good chance of recovering back to normal. So I guess the short answer is you can have a heart attack and then be completely normal afterwards.
That's incredible that with help you can have a normal functioning heart so quickly. And if you and I have a reality TV show, we're going to call it Clot Busters. Okay. Now we have another question, and this is another question from Kaya from Miss Clem's class. How many heart attacks can one person have in a lifetime?
Whoa. Well, I would say I don't know the answer to that, but I've seen someone who's had several. I think the most I've seen someone have is about 6 heart attacks. And the reason why someone may not have that many heart attacks, well, one is heart attacks, if not treated, could be deadly. However, as we just talked about, there are things that you can do to prevent heart attacks from happening. So generally, when someone has a heart attack, we teach them about things that they can do to prevent another heart attack. So besides taking their medications, eating right. So we talked about salt before, so reducing salt, reducing fats, exercising, having a good nutrition. So doing all of that, hopefully someone wouldn't have too many heart attacks. In general, you want to have 1 heart attack and no more than that.
Or less. We have another question.
None at all.
If a person stayed active for their whole life, would that make them less susceptible to heart disease?
Yes. So that's a very, very good question. That's one of the things you want to do to protect yourself. And I think it protects you from any chronic condition. So from, weight, from diabetes, but staying active. And by staying active, and for children, these days we spend a lot of time looking at video games and looking at TV, but you just get up and go outside and ride the bike and play basketball and walk and run and track. But generally, we want people to be at least 30 minutes active on most days of the week, doing any of the things that I just talked about. And if someone does more than that and stays active on most days of their life, then yes, they will have a healthier life and they'll live longer, healthier lives.
Well, we have time for one more question here. This is from Ava. What can we do now to become successful in your field?
Okay, and that's a great way to end the series. Well, first of all, I would just want to say that nothing is impossible, and if you have a dream, the dream you can achieve it. But I would say maybe find a mentor or someone who does the type of work that I do, even now at your age in school, and maybe you can spend a day observing or looking at what they do and start asking questions. Then once you do that, you want to spend some time learning science and getting interested in science. Because for the work that I do, you need to know a lot about science. So learning biology and chemistry and physics, all of those will come later. But really starting to learn science and following them, and then really pay attention to your lessons and paying attention to what the teachers say. Because to go on to become a doctor or cardiologist, you have to have really, really good grades and a lot of A's, basically, a lot of high grades, because they really want to make sure that later on you will be paying attention, you will be smart, so that you could look out for different conditions that may occur with your patients. But you can do it, and you can start now, because I sort of knew already by the time I was 12 years old that I wanted to be a doctor.
Well, there you go. You can start right now. Well,
Yes.
unfortunately, we are all out of time. Dr. Fergus, thank you so much for coming here and joining us and telling your story.
Thank you. It's been an absolute pleasure, and I hope that we all learned something today. I did. I learned a little bit as well, because some of those questions were really, really awesome, and they made me think a little bit as well. So it's my absolute pleasure to be here, and thank you so much.
Thank you. We'll hopefully see you again. Now, this is the last event of the school year, so please join us again in the fall for our STEM role model series as we go again. And you can keep up with the website and on our social media to find out details about the next event. And until then, I'm Haley Nelson with Jason Learning. Join us again for Jason Live.